Go ahead, ma'am.
So, good evening, everyone. I'm Dr. Sayali. I'm the fertility specialist at Oasis Fertility, Pune. So, I welcome you all for today's Facebook Live session. And our topic for today is causes of infertility. So, here, checking both partners is equally important. Now, what is infertility? When a couple who is below the age of 35 is unable to conceive after one full year of unprotected sexual intercourse, then these individuals are, said that they are infertile and they need to take some form of treatment, so that they can fulfill their journey of parenthood. Individuals who are above 35 years of age, now because of the maybe the quality of the eggs, the number of eggs, the reserve of the oocytes in the female, or the quality of the sperms in the male, it is said that if the individual or the couple's age is above 35 years, then infertility is considered in them if they have tried for a period of 6 months with unprotected sexual intercourse during the fertile period and they are unable to conceive. So now coming to the types of infertility, we preferably first have the primary infertility in which a couple has never conceived in this 1 year period of unprotected sexual intercourse. Secondary infertility is when a couple has conceived, when a woman has conceived for the first time, but she is not able to conceive the second time. Unexplained infertility is when a couple has undergone through these extensive testing, and there is no problem whatsoever in their reports. And this is known as unexplained infertility, where we don't know what the reason is. Now, coming to the incidence of infertility, it is said that 1 in every 5 couple suffer from secondary infertility. When you talk about the males and female as a contributor to infertility, here we have to see that the males as well as the females are equally responsible, and it is not always the females that are to be blamed, for not being able to conceive or for being infertile. Now, here, only males are responsible for 33% of the infertility cases. Only females are responsible for another 33%, and combined male and females are responsible, for another 33% of the couples. Therefore, males are, equally responsible for, the couple being infertile when you compare it with the females. In another 25% of the individuals, they have more than one factor that is contributing to their infertility. Now, coming to the causes of infertility in males as well as females. So, in males, the sperms are getting produced in the testes. Now, here the conditions that affect the production of these sperms are conditions that affect the quality of the sperms that are produced, such as, congenital absence of testes because of some genetic defects, or there is some hormonal abnormalities in individuals who have hypogonadism, or in conditions like undescended testes, excessive use of steroids, or if there are some infections in the form of chlamydia, gonorrhea, HIV, or mumps infection, or conditions such as varicocele that is affecting the testes. In these conditions, the sperm production, or the overall quality of the sperm is affected. Then there are conditions that are going to affect or prevent the sperms that are produced in the testes from reaching the female genital tract. These are going to be conditions like premature or retrograde ejaculation in the male, blockage of the testes, or there is congenital absence of the vas deferens, or conditions where the outlet tract has been blocked, that is there is vasectomy done, or injury to the male reproductive organs. These are all going to result in the absence of the sperms getting deposited out or reaching the female reproductive tract. There are environmental factors such as exposure to these environmental toxins, exposure to pesticides, any form of radiations, excessive exposure to heat, excessive exposure to the sunlight or any form of radiations, in the form of radiations from computers or laptops, or excessive exposure to heat in the form of sauna bath. Now these are going to this is going to damage the sperms that are stored in the tract, and this is going to decrease the motility as well as the morphology of the sperm. Then individuals who have undergone cancer therapy in the form of chemoradiation, this is going to affect the overall production of the sperms, and it is also going to affect the quality of the sperm in terms of motility and the morphology of the sperm. Now, these are the conditions that are going to, cause male infertility. Now, what are the tests that are available by which we can diagnose these individuals, as being infertile? So, first and foremost, the most important test in a male to diagnose, infertility or decreased fertility is a semen assessment. Here, we need to know the count of the sperms. According to the WHO assessment, the count should at least be 16 million. The motility should be in the range of at least 32%, and the morphology or the normal form of the sperm should at least be 4%. So, semen assessment, whether it's decrease in the count, motility, or decrease in the morphology, is going to, overall affect the fertility potential of the male. There are blood tests such as your thyroid levels, your prolactin level, your hormonal assessment in the form of your, the follicle stimulating, luteinizing hormone levels, your testosterone levels. These are the hormones that are necessary, for the testes to function or improve the production of the sperms in the testes. So any abnormality in the hormones will, help us decide what is the kind of abnormality that the male is suffering from, and what is the cause of infertility or decreased sperm production in the male. Then there can be some form of genetic abnormalities or chromosomal abnormalities, where because of some genetical rearrangements or genetical deletions or duplications, that the testicular function or overall production of the sperm in these individuals might be affected. So not only do these individuals suffer from something known as a decrease in the sperm count, motility, or absence of sperm, but these individuals who are carrying genetic or chromosomal abnormalities, they also have the risk of transmitting that particular abnormality to their offsprings. Then we have a sonography of the scrotum area along with the Doppler to know the proper blood flow to the testes, to know the size of the testes, and to detect conditions such as varicocele, hydrocele, or any absence of structures in the testes, such as absence of vas deferens, epididymitis, and all that. That will help us to know the cause of absence of the sperms, or cause of the decrease in the quality as well as the quantity of the sperms. Now we have discussed here about the causes of male infertility. Similarly, coming to the causes of female infertility. Now, in females, usually we have the egg that is released by the ovaries at the time of ovulation. So, the woman needs to have adequate number of eggs or adequate number of follicles inside the ovary. That is known as her ovarian reserve. So, individuals who have decreased number of follicles or decreased number of oocytes, as happens in individuals who are of an advanced age, or young individuals who are having a premature ovarian insufficiency, these individuals have decreased chances of fertility. Then the egg that is released from the ovary needs to be picked up by the tubes. So individuals who have tubal factors, where the tubes have some form of infection in the form of a hydrosalpinx, or blood is collected in the tube in the form of hepatosalpinx, or there is blockage of the tubes, or PID, where the tubes are damaged, this also is going to affect the natural pregnancy process. Then the embryos that need to be formed, the process of fertilization needs to take place in the tubes, and then the embryos that are formed need to be of the good quality, and these embryos then go and attach themselves in the uterus. So conditions affecting the uterus, that is conditions, individuals who have any form of uterine abnormalities, individuals whom the endometrium is thin and that's not able to support the baby or the growing embryo, these individuals can also have decreased chances of fertility. Other conditions of the uterus, such as fibroids of the uterus or any form of polyps inside the uterus, hormonal conditions such as endometriosis or adenomyosis, this can in turn affect the fertility potential of the individual. Then we also need to know the hormonal assessment of the woman, okay, because any form of hypothalamic or pituitary disorders, these are principally the glands that are going to release the hormones that act on the ovaries to produce the eggs. So any abnormalities at the hypothalamic or pituitary level is going to cause decrease in the overall egg production. Hypothyroidism or hyperprolactinemia, these are conditions that are going to affect the fertility of the individual. Genetical conditions are such as congenital absence of the ovaries or congenitally very small ovaries, or conditions such as there is absence of the uterus. These conditions are going to overall affect the fertility potential of the woman. How will you diagnose this thing, females with infertility? So first of all, we need to have a detailed pelvic examination where we'll be able to know about the shape, the position of the uterus and the other organs associated. Then an ultrasound, a 2D or 3D ultrasound, will give us a picture of the uterus, whether there is any hormonal abnormalities in the form of adenomyosis or endometriosis. It will help us to know the internal lining of the uterus, that is a 3D sonography will help us to know how the cavity is, if there is any form of fibroids or if there is any form of polyp inside the uterus or the uterine endometrium. Then what is the overall ovarian reserve in the form of the antral follicle count, if there is any abnormality that is present inside the fallopian tubes, or if there is any adnexal pathology. So a sonography will help us to diagnose the fertility potential of the woman. Blood tests such as whether the woman is ovulating or not, the LH kits can be used to know the ovulation period of the woman. Other hormonal assessments such as your LH, your FSH level, your thyroid, your prolactin levels, your estrogen level, the level of these hormones will help us to know the fertility potential. These what is the hormonal inputs in these women. Then we have something known as the hysterosalpingography or the SSG, that will help to detect the patency of the tubes. Or There's hysteroscopy and laparoscopy that will help us to find conditions such as your endometriosis, conditions such as pelvic inflammatory conditions, any form of fibroids. So a diagnostic hysterolaparoscopy, will help us to diagnose conditions that are affecting fertility in these individuals, and an operative hysterolaparoscopy will help us to treat conditions such as blocked fallopian tube, doing a laparoscopic ovarian drilling in PCO patients, getting the fibroids removed, or a hysteroscopic polypectomy or hysteroscopic fibroid removal. These can help to diagnose causes of infertility in the woman, as well as it will also help to treat the factors that are responsible for causing infertility. So we have dealt with the factors that are responsible for male and female infertility. So from the above discussion, we come to know that it is not always the male that is the female that is always responsible, in the couple for being infertile. It is the male also contributes equally in the infertility. So it's not always the female who should be investigated. There is equal importance in investigating and treating the male, to improve the chances of conception in the couple. So we have gone through the investigations that should be done in the male and the female. Now, what are the preventive measures that the partners or the couple per se can follow, so that they can improve their fertility potential? So first foremost is to maintain a healthy weight. They need to have adequate exercise, take a good protein diet, take adequate sleep, do away with the addictions. Try to lead a stressful life, and try to get that adequate 8 to 10 hours of sleep in a day. Treatment of any sexually transmitted infections if diagnosed in any of the partners, and they should have limited exposure to the environmental toxins, limited exposure to heat, radiations in the male partner. So these are some of the preventive measures that will help them to improve their fertility potential. maintaining an ideal body weight, maintaining the adequate level of activity, this is also very important. So coming to the treatment of the conditions that we have seen, so first of all, lifestyle modifications in the form of what we have discussed, that is maintaining healthy weight, doing away with the addictions, having a good adequate sleep, having proper exercise, eating the right kind of food. This is all very important, to improve your fertility potential, to improve the quality of the sperms as well as the quality of the eggs. If the individual is suffering from some anovulatory disorders, like if she has PCOS, she is not able, the follicles are not able to form, the eggs are not getting released, or if she has a decreased ovarian reserve, or if she has failed certain fertility treatment, then treatment in the form of fertility medications can help her to improve the ovulation process and to improve the quality of the eggs. Medications to the male partner in the form of antioxidants can help improve the quality. Then, depending upon the hormonal assessment, there are some hormonal injections that can be given in these individuals, to improve the seminal parameters. Then, coming to the surgery aspect in Okay, so in the male partner, if the male is suffering from conditions such as a varicocele or a hydrocele that is affecting the semen parameters, or if there is any form of blockage to the outlet tract, or if there's vasectomy done and he wants to get a reversal of the procedure done, or in the female, if she's suffering from PCOS, ovarian drilling, or she has fibroids, myomectomy for the fibroid, or myomectomy for the fibroid, if there's blockage of the fallopian tube, laparoscopic removal of the blockage or the recanalization can be done. Hysteroscopically, the individual can be treated for thin endometrium, or if there's any form of the endometrial polyp or fibroid. Then following this, there are treatment options available in the form of ovulation induction, where we give fertility medications to improve the growth as well as the quality of the oocytes, and the individuals are asked to have natural contact. Ovulation induction followed by the timed ultrasonographic monitoring, and having sexual intercourse during the time of ovulation can increase your fertility potential, especially in individuals who are having anovulatory cycles. Here, the chances of conception every cycle is around 6 to 8%. If you are not able to conceive by 3 to 4 cycles of ovulation induction, or if the seminal parameters or the oocyte quality is compromised, then the individuals can go for intrauterine insemination, that is ovulation induction followed by monitoring and IUI of a proper processed semen sample. The semen sample is deposited into the uterus of the woman. Now, here the chances of conception with every IUI cycle, with individuals who are having normal seminal parameters or decrease in the motility, and women with good ovarian reserve, is around 15 to 18%. Then, in individuals who have severely deprived semen parameters, or the quality or the quantity of the eggs is on the lower side, or individuals who have conditions like thin endometrium or some hormonal abnormalities, in these individuals, IVF ICSI can be tried with a good success rate. And individuals who have very low the same quantity of the oocytes that are available, or the quality of the oocytes are very poor, then they can go for donor oocytes, or in the male partners where the sperms are absent or there's some genetic abnormality in the sperm, then they can go for the donor sperms that is available. So these are the treatment options that are available. So in today's session, we have dealt with how important it is, to diagnose both the partners whenever, we are trying to give them any form of fertility treatment. So contribution from the male and the female partner is, almost equal, and it is not always the female partner that is to be held responsible for infertility. So this is all that I had from my side regarding this topic. I hope some of your doubts are clear. So let's see if we have any questions that are coming over from our viewers. Okay, so thank you everyone. I hope the session was informative. So, for any queries related to this topic or any help needed, kindly dial the helpline number that is given below, or you can reach us physically at any of our two centers, that is Oasis Fertility at Wakad or Oasis Fertility, Adisa Avenue at Kharadi. Thank you.